Thank you for watching Weekend Prime and welcome back. Now, they're readily available, often purchased without a prescription and widely used to treat fever, headaches and various types of pain. But while these medicines offer quick relief, their prolonged or improper use may unknowingly harm one of the body's most vital organs, and that's the kidney. Now, on this episode of Health Digest, Gloria Melimo looks at how everyday painkillers can silently damage the kidneys and, in severe cases, lead to dialysis. Take a look.
More often than not, many people turn to over-the-counter painkillers to manage headaches, joint pains, or general body aches. But beneath that common habit lies a risk that is often overlooked, and that's the overuse of painkillers and their impact on kidney health. While both prescription and over-the-counter medicines can potentially affect the kidneys, specialists warn that frequent use, high doses, or prolonged consumption without proper medical guidance may increase the risk of kidney inflammation, reduced filtration ability, and in severe cases, chronic kidney disease. Dr. Ahmed Twahir, a kidney specialist in Nairobi, explains that certain groups of painkillers can interfere with normal kidney function. These include non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, which are widely used in pain medicines such as ibuprofen. Experts say these medications interfere with the production of important chemicals that help maintain adequate blood flow to the kidneys. When this process is disrupted over time, kidney function can gradually deteriorate.
These painkillers block or prevent the formation of certain hormone called prostacyclin. Now, prostacyclin causes widening of the blood vessels that supply the kidneys. When you use these strong painkillers, you reduce the level of prostacyclin, and then the supply of the kidneys shut down. So you are literally starving the kidneys of blood, and they shut down and those cells die. A lot of people will continue with these painkillers for months and months and months, and by the time they realize only 10% of their kidneys are working.
A study by the American Academy of Family Physicians indicates that up to 20% of kidney damage within a population may be linked to prescription and over-the-counter medications. The risk is particularly high among the elderly.
You can get kidney damage by just bad luck, even one tablet. Now there's the chronic usage of these painkillers where you'll find elderly people on painkillers for the last 3 to 6 months because of lower back pain, because of knee joint pains. So we see this more commonly. As you continue taking them, your kidneys get more and more weaker, and at this stage you require dialysis.
Doctors also warn that painkillers are not the only medications that can affect kidney health. Certain antibiotics, some drugs used to manage high blood pressure, and diuretics, commonly known as water tablets, may also strain the kidney if not properly monitored. Diuretics, for instance, help the body remove excess salt and water, but prolonged use may lead to dehydration, which can negatively affect kidney function. Additionally, some chemotherapy drugs and mood-stabilizing medications have also been associated with kidney complications.
I would advise patients, if they have pain, just to take paracetamol, which is the Panadol, and if this doesn't help, then you need to go and see your doctor, who might give you something stronger under close monitoring to see whether those drugs will give you some side effects.
People with undiagnosed medical conditions are particularly vulnerable to kidney damage when using such medications. This is why health experts emphasize the importance of regular screening and cautious use of painkillers.
People who are, let's say, between 30 and 40 should get a baseline screening and then screen every 3 years. Once you are between 40 and 60, then every 2 years, and once you're over 60, then annual screening would make a lot of sense. It involves doing a simple urine to check for protein. It involves doing blood sugar to see whether you are diabetic or borderline diabetic, likely to develop frank diabetes, which can damage your kidneys. They will do your blood pressure.
The kidneys play a vital role in filtering waste products from the blood, regulating body fluids, and maintaining blood pressure. Each kidney contains thousands of tiny filtering units that remove waste and excess water from the blood, producing urine. But when the kidneys lose this ability, water products, fluids, and electrolytes begin to build up in the body, a condition that may eventually require dialysis or a transplant.
By the time you get symptoms, which are usually fatigue, swelling of the face, swelling of the legs, and as time progresses, you start getting nausea, vomiting, and you might even collapse and rush to the casualty. This is usually too late. So we are emphasizing that we need to screen early.
Globally, chronic kidney disease affects more than 800 million people, with an estimated 4 million cases in Kenya. It is currently ranked among the leading causes of death worldwide. Over-reliance on painkillers without addressing the underlying cause of recurring pain may temporarily mask symptoms while placing significant strain on vital organs like the kidneys. Health experts, therefore, urge the public to use medication responsibly, seek medical advice when pain persists, and prioritize regular health screenings to protect kidney functions. Gloria Milimu, KTN.